Tonight is a night of reflection as we approach 1 year since our world was completely flipped upside down and our lifestyles changed in the blink of an eye.
I just recall thinking, this is bad. This is really, really bad.
It might feel like a lifetime ago since we were able to live without the thought of getting sick or even wearing a mask.
A statewide order for people to stay at home.
Those changes hit businesses hard as they went through a battle to keep their doors from closing for good.
It is our priority as we continue to mitigate and contain the spreading of this virus.
The warnings about COVID-19 were fast and frequent as state leadership to local congressmen addressed the public.
Be a good neighbor, be a good citizen. Those young people that are still out there on the beaches thinking this is a party, time to grow up.
We'll take a look back at all of that, including how the pandemic became political, how Zoom turned into the new way to teach, and how the big toll the small virus took on mental health. We'll also share some positive things people learned during these trying times. And maybe, most importantly, we'll discuss where do we go from here. This is COVID-19, 1 year later. Good evening and thank you for joining us here on broadcast or a streaming platform. I'm Alex Bell. It's been a year since the word coronavirus entered our lives, and since then, a lot has changed. Tonight, we look back and hear from some of the people impacted by it and reflect on how our lifestyles changed. We're taking you back to March 2020, when Kern County first shut down. On January 21st, 2020 is when the first case of coronavirus was confirmed in the United States. By February 29th, the first coronavirus death in the United States was announced. Shortly after, on March 4th, Governor Gavin Newsom declared a state of emergency in California, and the first coronavirus death in the state was announced. However, on March 9th, Kern County was still in the clear.
There have been no confirmed cases of COVID-19 here in Kern County.
6 days later, Governor Gavin Newsom orders all bars, nightclubs, wineries, and brew pubs to close, also telling adults age 65 and over and those with chronic health conditions to stay home. Throughout the month of March, grocery stores witnessed panic buying setting in. Shelves became empty, and water and toilet paper became nearly impossible to find. On March 17th, COVID was first discovered in Kern County as one patient tested positive. 2 days later, on March 19th, the governor announces a statewide order to shelter at home, affecting 40 million Californians and restricting all non-essential travel and activities outside the home. Almost a month after the first coronavirus death was announced in the United States, Kern County Public Health confirms the first COVID-19 related death in the county, Susie Garcia, a local business owner. By April 1st, Governor Gavin Newsom officially announced that public schools will be closed for the rest of the academic year. Just 2 days later, the CDC and the White House Coronavirus Task Force now recommend Americans wear face coverings when in public. By early June, California began allowing schools, bars, and gyms to begin resuming operations. And the search for a vaccine was also underway. But with the holidays approaching, the state and health officials urged residents not to travel. On November 19th, the governor issued a new travel advisory, asking residents to limit travel outside and into the state. By December 13th, the first doses of Pfizer's coronavirus vaccine arrive in California. And on December 17th, Kern Medical became the first hospital in the county to administer Pfizer's COVID-19 vaccine. By the end of December, though, Kern County reached grim numbers. On December 22nd and December 30th, a public health official confirmed 16 people died each day, which are the highest single days of death. As the new year began, vaccines started making their way to those most vulnerable populations. On January 13th, California began allowing those 65 and older to get vaccinated. And by the end of January,
all regions effective immediately are no longer in the stay-at-home order.
Almost a year later, when the first case was confirmed in the United States, the governor lifts the regional stay-at-home order for all of California, stating ICU availability has improved. On March 10th, 2021, the House passes a $1.9 trillion COVID relief plan, giving aid to millions of Americans who continue to struggle through the pandemic. But as we look back, we can now see some of the factors that turn COVID-19 deadly for some patients. And here in Kern County, 2 underlying conditions were present for a majority of the deaths. Of all the people we've lost to COVID-19, many of them also suffered from hypertension, which was the leading comorbidity in Kern County residents. Diabetes was the second leading factor in a number of COVID-19 related deaths. Roughly 1,400 people had an underlying condition when they were infected with COVID-19 and later died. There were just 29 people in Kern County who died of COVID alone. Now, when we look at the ages of those who have died in our community, the majority of people were over the age of 65. Those aged 50 to 64 make up the second largest percentage of COVID-19 related deaths, while 105 patients' deaths between 18 and 49 have been attributed to COVID-19. These numbers do follow the national trends, and local data shows no children or teenagers have died due to coronavirus. Public Health updated these demographics this morning. And as we learned about this new pandemic, President Trump's coronavirus task force rolled out recommendations on how to deal with this new virus. And it was touted as 15 days to slow the spread. But that quickly changed industries across the country, shutting down. Some of them would never reopen again.
We're now in the third month of 2021, and it seems like everything Governor Gavin Newsom is doing now is geared towards reopening the economy, reopening industry, reopening schools, and reopening various businesses. But we do know throughout this pandemic that a lot of those businesses didn't survive. And for the businesses here in Kern County, shaking off the financial setbacks is far from over.
In the 28 years that I've worked here, without a doubt, my hardest year in business.
I thought that it would last a couple of weeks.
What business owners believed to be a short-lived blow to revenue,
A whole year later, it's still here.
was instead a period that crippled thousands of businesses across California for good.
I have a lot of empathy for the ones that didn't manage to survive.
It was March 2020 when Governor Gavin Newsom ordered the closure of all bars, nightclubs, wineries, and brew pubs. A few days later, he issued his first shelter-in-place order.
We direct a statewide order for people to stay at home.
Non-essential activities outside the home were prohibited. Dining in restaurants, exercising inside a gym, and getting your hair done were among the many things the mandate did not allow.
I really thought it was only going to be a temporary situation.
Ramona Potts owns Atomic Kitten Salon in downtown Bakersfield.
Please wear a mask.
She took Newsom's first closure order to heart.
I didn't want anybody to be hurt or die because they came to get their hair done.
But additional restrictions would follow. New regulations and reopening models would be handed down by Newsom, and those changed several times.
The most frustrating part was doing everything I possibly could to make sure I followed all the rules and everything was in place to keep everybody safe, and then have them close again.
Newsom rolled out a 6-point framework to reopen the state on April 14th, 2020. On May 26th, he allowed several industries to reopen, including restaurants, gyms, and theaters. Then, on July 1st, he shut down indoor operations for those industries in 19 counties.
Every day was literally a new day.
Gino Valpredo owns Luigi's in East Bakersfield. He says keeping up with the new regulations felt impossible.
It seemed to get crazier, between the trying to figure out what we're supposed to be doing and the different regulations, and we let 28 people go. 3 weeks later, rehired 28 people. 20 of them, 10 of them didn't want to come back. So it's truthfully been insane. And then we went from outside to partial inside, and then sometime in June, completely open.
But being completely open would last only for a couple of weeks. In July, Newsom announced new restrictions that will again order the closure of several industries. But contrary to the downward direction many businesses were going towards at this point, some businesses experienced the opposite.
Everything's gone really well. With this whole pandemic, it's actually been a boost to my business.
And that's because Mark Pacheco, the owner of a local Bakersfield gym, didn't follow the closures. He's kept the weight of the governor's orders on the bench rack since.
When all this nonsense started about the business closures and, first you have to close, then you can open, and then a soft close, and then we'll allow this but we won't allow that. It was the blind leading the blind. It wasn't about anybody being in a position where they have the knowledge or the wherewithal to really determine what was best for us. At that point, I go, you know what? They can go themselves, because I'm not going out that way. I'm not going to kiss their ass.
In December, Newsom would roll out another shelter-in-place order. This one would introduce many of the same restrictions as the order back in March, requiring several industries to close again. But by this point, some businesses lost faith in the government's credibility to govern.
We just finally gave up and said, okay, we're going to do what we're going to do to keep ourselves and our clients safe. And hopefully there won't be any repercussions from that.
I didn't know whether to close, but everybody come in and give me a high five and say thank you for staying open. We really appreciate what you're doing.
I pretty much handle business as usual, and if people are offended by that, they don't have to come here.
And 23ABC recently learned that the city and county don't keep track of the pandemic-related business closures. However, the Kern County Hispanic Chamber of Commerce and the Kern County Black Chamber of Commerce recently took it upon themselves to conduct a survey with the local communities here to learn how those businesses have been impacted by the pandemic. They say that the results are expected in the weeks to come. In downtown Bakersfield, Bayan Wang, 23ABC, connecting you.
As the transition to working from home started, some industries were able to adapt while others weren't. The United States unemployment rate peaked at 14.8% back in April of 2020. During the same time, unemployment in Kern County also peaked at roughly 19%. According to the National Bureau of Economic Research, the start of the pandemic marked the end of the longest period of economic growth in American history, following the crash of 2008. Now the unemployment rate rests at around 6% nationwide. But the pandemic wasn't just a public health issue. It turned political too. Politics seemed to play a role in shaping the public's perception of the virus, with many leaders scrutinized for their response to the crisis.
Some of history's most respected political leaders have come at times of crisis. George Washington helped lead a nation to independence, Abraham Lincoln helping to heal a nation at war with itself, and FDR helping to lead the way through World War II and the Great Depression. Now, with all that in mind, it's no surprise that those in positions of power became focal points as America shut down last spring.
It's dominated everything, whether it's the news, whether it's our personal lives, or whether it's politics over the last year.
Last March, as the COVID threat became apparent, these are the types of images that many Kern County residents and Americans at large got used to seeing.
March 16th, as most of you know, we declared a countywide local emergency.
Leaders on the local, state, and national levels holding regular press briefings, giving the latest on the COVID threat.
Reduce the current occupancy within these establishments.
The message was uniform at first, as little was known about the emerging threat. Those in positions of power mostly erring on the side of caution as more was learned about COVID.
Doctors Dan Erickson and Artin Masihi.
But as April came, 2 Kern County doctors became the center of national attention, calling for the end of economic restrictions.
We've never, ever responded like this in the history of the country. Why are we doing this now?
YouTube removing the clips of the doctors, saying their statements contradicted health authority guidelines. Kern Public Health also disagreeing with the doctors, but County Administrative Officer Ryan Alsop with a different tone, saying Dr. Erickson was courageous. As summer passed and many economic restrictions remained, Alsop also weighing in on the state's handling of the crisis too.
Governor, Kern County joins other counties in demanding that you stop moving the goalposts on us.
The county speaking out against Governor Gavin Newsom's economic restrictions, questioning why businesses are being restricted when county contact tracing data showed that the virus spread the most in households, not businesses. Newsom also the target of conspiracy theories.
People, argue that Gavin Newsom wanted to remake California and he was going to use this crisis to do it. Some people didn't wear masks as a political statement on the right.
Newsom was largely applauded for his response at the beginning of the pandemic, including by President Trump. But as many Californians grew frustrated with economic restrictions and he was seen maskless at a dinner party in November, that changed.
The spirit of what I'm preaching all the time was contradicted, and I got to own that. And so I want to apologize to you.
Also suffering political losses in the 2020 election cycle, Republicans. The party losing the White House and the Senate, something our political experts attribute, at least in part, to many people being out of work.
Most presidential races for re-election are simply referendums on the state of the economy.
Many analysts believe President Trump made early pushes to reopen the economy for this reason. Now that Democrats control Congress and the White House, it's easier for them to pass legislation like the $1.9 trillion American Rescue Plan.
Because of, in my view, the pandemic, which I think shifted enough votes to the Democratic Party for them to take control of the government.
Now, looking ahead, the main things to watch out for are whether or not Newsom's recall effort gets enough signatures verified by the California Secretary of State. Also, Biden's continuation of the vaccine effort that was originally called Operation Warp Speed under President Trump. In Bakersfield, Austin Westfall, 23 ABC, connecting you.
But one of the biggest impacts caused by the coronavirus was the toll on kids and their education. Schools were also forced to close, and nearly a year later, some kids haven't even been back in the classroom since. We're unpacking that after the break. And 1 year later, we've gathered local officials to talk about where Kern's fight against COVID-19 is taking us. That roundtable discussion only on 23 ABC. Welcome back. The pandemic changed the way that we educate our children in schools, as well as how students learn. Almost overnight, Kern County schools had to completely shift their curriculum to being completely online.
Around this time last year, students had just gotten the news that they would not be returning to the classroom and would have to be doing distance learning. Now, no one could have imagined that this would have lasted an entire year.
Last spring was, quite frankly, very, very bumpy.
On March 15th of 2020, Kern County Public Schools announced that they would be temporarily closing their schools. It was recommended that within 3 days, all schools would switch to remote learning.
Well, the first initial reaction, I remember calling the student body out going, okay, guys, we have to shut down for 2 weeks. I'll see you back in 2 weeks. And now looking back, I would have handled that so much differently.
On March 25th, just days after the original announcement, school was then closed for the rest of the school year.
The public education system as we knew it had to be basically reimagined overnight.
Teachers and students adapted quickly, educating and studying in their own homes through Zoom. Challenges continued for students outside of the classroom as well, since school provided some of them with basic needs.
In Kern County, where there's a huge population of working families, they rely on their schools to provide a safe place for their children to be during the day. Not to mention that many of our students in Kern County receive three meals a day from their schools.
Being taught online was a major adjustment for students throughout Kern County, which came as a struggle for some.
It started off really rough because I remember thinking, I just have no motivation for this. I was so done.
While other students felt differently.
For me personally, it was much easier because even though I learn just as well with the teacher, I also learn just as well when I'm by myself. And I know it's not the same for a lot of kids in school.
For the majority of public schools in the county, distance learning continued throughout the year, which led to some students transferring to schools where in-person learning was taking place. Enrollment increased for private schools like Garces Memorial, but enrollment for kindergarten took a slight dip in some school districts.
This is probably simply due to the fact that kindergarten is not mandatory, so many parents may have elected to have their kindergarten-age students sit this year out because of all this uncertainty with distance learning.
When it came to student performance, KHSD released data in February of 2021 showing that there was a 14% increase in students who received D's and F's in the fall of 2020 as compared to the fall of 2019.
It's been incredibly disruptive to have had our school buildings closed in many cases for a year now.
But while school has been challenging for students, teachers, and staff, officials are proud of how much everyone has overcome.
And we're in, frankly, a much better spot today than we were a year ago. And I think this is largely due to the grit and determination of so many people in Kern County's public education system, from the teachers to the support staff to administrators and everybody involved.
As of right now, teachers are now starting to get the COVID-19 vaccine in hopes that someday soon, students will be able to return to the classroom. In Bakersfield, Bain Ferroni, 23 ABC, connecting you.
And now let's break down the impact on different demographics here in the county, including by death. Public health officials say that of the nearly 1,000 people who have died because of COVID-19, most of them were men, and that accounts for roughly 60% of deaths. Women make up the other 40%. And when it comes to race, Hispanic people were more likely to die from COVID-19 in Kern County. They make up roughly 60% of deaths. White people follow with about 30%, and African Americans and people identifying as another race making up the remaining percentage. In 1 year since the pandemic started, we've lost nearly 1,000 Kern County residents to this virus. 23 ABC's Leslie Gooden reconnects with the family of Susie Garcia, who was the first person to die because of COVID-19.
That's how we keep her legacy alive. We continue to relive the good memories that she left us with.
It's the biggest part that we miss, like not having her there anymore and not hearing her laugh or seeing her smile or hearing her talk.
You can watch the entire story on our website, turnto23.com. And one of the biggest things the pandemic has impacted comes in the form of mental health. Students not being in class, businesses closing, and lifestyles changing all cause some mental health concerns. 23 ABC's Calvin Hodman finds out services were up to those in need.
Take a moment and think about when you realized COVID-19 is something big, something real, and something not going away anytime soon. Even in those moments, none of us could have predicted how big of an impact the pandemic would and still does have on our mental health.
Depression, anxiety, stress, worry, everything kind of exacerbating on top of the situation that we've had to go through for the last 12 months.
Mental health has been put to the test for many people in the past year. For example, Kern Behavioral Health and Recovery Services saw 800 more calls come into their mental health crisis hotline in December 2020 compared to December of 2019.
I think initially we kept waiting for things to come back to normal, and it took a while for us to realize that this is going to be our new normal.
Behavioral health director Stacey Kuwahara says people who had never before dealt with anxiety or depression were thrown into stressful situations. Those already facing mental health issues, especially younger people, found it even harder to cope.
The one thing that I notice about kids is they are just very intuitive and always very in tune to what's happening around them in their environment. So family stress is 100% going to be affecting them.
Still, according to Program Support Supervisor Ellen Eggert, Kern County did not see an increase in suicides during the pandemic. But she says suicidologists believe there may be an increase at the end of the year.
People who never had thoughts, more are having thoughts. And we see that with our youth because they're not, with each other. And we see it with adults too. So the biggest thing is most people think it can't happen to them or their family. And so we've got to become more suicide aware.
Especially for kids. Eggert says most parents talk to their kids about drugs and alcohol, but not suicide. She says that needs to change, especially with the end to the pandemic not quite in sight.
Because we're talking life and death here, but we all have to get comfortable with it.
Kern Behavioral Health offers a free 1-hour suicide awareness training. Eggert encourages everyone to take it.
It just talks about warning signs, how to ask the question, all of those things that if we could erase that stigma and realize that suicide prevention is everybody's business, but also every single one of us at some time in our life could be at risk for suicide.
Even as we're beginning to see more vaccinations and fewer restrictions, Eggert says we need to be taking care of ourselves.
The good thing is there is light at the end of the tunnel, but that tunnel's long.
The suicide prevention hotline number is right there on your screen. It's 800-273-8255. We'll also have links to more resources on our website, turnto23.com. Here in Bakersfield, Callan Hodman, 23 ABC, connecting you.
2020 was hard for a lot of people, but many were able to find their silver lining during the pandemic. Coming up next, we'll show you how the community banded together to make it through the year.
Welcome back. People have been coming up with ways to spread a little joy throughout the community, with car parades, drive-thrus, and distance celebrations were also very popular during this last year, as was the chance to work from home or just to get away from it all. 23 ABC's Mike Hart takes a look back at a few moments that brought a smile to Kern County.
I was super happy because I missed them for a really long time.
Teachers and students have been looking for ways to show their appreciation since the initial lockdown.
They had decorations on them. Some of them said, "We miss you."
And car parades were a popular distraction for young and old, from veterans to frontline workers. And drive-through graduation ceremonies. For those working from home, the pandemic taught many people they could do that from anywhere.
Both of us worked from home for quite some time when COVID first happened because of the unknowns. And we were able to keep rocking and rolling and getting things done.
How are you going to grow from this tragedy unless you stay positive?
While others who maybe lost a job or watched it decline found unexpected time to improve their home life.
More time for my personal life, and I have more time for my health, and especially for my family.
Wendy Armijo shared her feelings on Facebook recently by just getting out and walking. It took her to new locations, and she says she's never going back.
I think people see that I'm happier, and it shows on my face. During this time, people really need a smile.
And you didn't have to look hard to find one.
What better way to celebrate than with some books and some candy?
That's it. Numerous local organizations ramping up their efforts to help those in need, whether collecting donations or passing them out.
By serving 2,000 meals a day, we hope that we have a positive impact in the community.
Even through financial hardships, people took a moment to help others, including our first responders and their families.
It's good to be able to be at an event like this. It's good for the community.
And there were plenty of moments throughout the year to throw around some good wishes and happiness.
These are unprecedented times, and it's nice to stay involved in the community. And I think as an organization, our goal is to get back on the ice as quickly as possible, as safely as possible.
A journey that has already begun without forgetting what helped to get us there. Mike Hart, 23 ABC, connecting you.
Coming up next, 1 year after the onset of the pandemic, we're talking to local doctors and public health officials about where we've been and where the county's headed next. Welcome back. Thank you so much for joining us. As we mentioned earlier, we are here with a panel of local experts, and we have a lot of ground to cover, guys, so let's go ahead and get straight to it. I want to go ahead and open up this question to everyone first. Looking back, at what point during the pandemic did you start to think things are getting serious? This is now turning serious, possibly even deadly. Open to anyone.
For me, it was as soon as we saw our hospitals being significantly impacted, and we knew we had to do something to ensure that our residents had access to a good level of care should they need it.
Did it get serious for anyone else here?
Yep.
Go ahead.
Well, yeah, for me, it was when in-person instruction stopped, and we immediately moved to distance learning. I think at that point, things got really real.
Yeah, Dr. Cothray.
So we noticed a similar effect in July and August is when we started seeing a surge in our patients in our hospitals. Our ICU started to reach maximum capacity, us having to surge out to other departments. So that's when it became really serious for us.
As a doctor, were you concerned about the unknown of this virus?
Absolutely, and I think that's the thing that scares us the most, is the unknown aspect of it. So I think all of us were extremely fearful of what this virus was, what it could do. As we well know, what it has done for all of us.
And Ryan, for the county.
I mean, to your question, I think there were a series of moments for me, not just in the beginning, but all the way up until just the last few months. A variety of different events, state directives, schools closing down, stay-at-home orders, businesses being shut down, kids not getting back to school. Many pivots, changes of direction. Hospitalizations fluctuating up and down. So a number of different things that have, at different points, were concerning.
And Jesse, I want to get back to you in education. As a teacher, what change have you seen in your students and their parents throughout this whole year?
Yeah, well, I think when it first began, the transition from in-person instruction to distance learning was really abrupt, and teachers had to completely change the way they did things on a dime. You know, there wasn't really a whole lot of opportunity to kind of test things out. So that was very difficult. What we've noticed, what we've tried to kind of figure out over this period of time is, you know, how do we do distance learning in a way that is conducive to learning? How do you engage students online? You know, when they're in the classroom, you know, being able to teach in the classroom, there's a certain way to do that. It's completely different online. And being able to engage students who are at their various homes with technology issues, with issues in regards to needing assistance, not having it at home, most likely, is difficult. So I think trying to overcome all those technological difficulties, as well as the engagement issues, and as well as the equity issues that also really surfaced over the course of the pandemic.
Yeah, and talking about equity, you know, we talk a lot about the students, but the parents too, making it work for their students. What have you seen change for parents?
Yeah, absolutely. I think if parents being able to, you know, having their students online, and then them themselves often having to be online. I mean, if you look with our teachers, we have a lot of our teachers who were having their students in one room, their kids in one room online doing distance learning, and they're in another room trying to conduct class. So it made it really, really difficult for I'm assuming for parents who were at home. But also, you know, with the issue with the you know, kids not being able to go to school, having to be at home, creating a lot of daycare issues. So that as well made a tremendous burden on parents in the household.
And this question open for anyone here. Do you think this last year will have lasting impacts on our education, businesses, the community as a whole? If so, what do you think it'll impact?
I think it's going to impact everything. We have a lot of cleanup to do following this pandemic. We've been locked in our houses for the past year. And in Kern County, we've already struggled with chronic disease. So I can only imagine how that has worsened over this past year, as we haven't been outside, we haven't been exercising, we haven't been going about our regular lives. So we're going to have a lot of cleanup to do following the pandemic.
Absolutely, Brent, I agree.
Yeah, I think the biggest tragedy the past 12 months has been the lives we've lost, right? We peaked over 1,000 lives due to the virus, but we've lost lives due to mental health issues related to the exercise that we've been in through this pandemic. And it's affected our children, it's affected their parents, it's affected people just holding on, trying to make ends meet. And, you know, however, you've got kids that have been, many of them in our community have been out of school. Online learning, as was said, is not the same as being in the classroom. They've been out of school for a year. Their lives have been changed in a permanent way, missing a year of school, essentially, of real school. You've had the business community, small businesses struggling to make ends meet. You know, they just don't snap back. They've had 12 months of suffering and trying to survive, trying to pay bills, trying to pay creditors, etc. So this isn't going to be just a snap back to normal. I think that the effects of this, I fear, are going to be felt for some time to come, and I'm not sure how long that's going to be. I hope it's not long, but I think we're going to be seeing the effects for quite a while.
So, Dr. Cothery, do you think the medical field is going to be forever changed?
We've already seen the changes. You know, there's several things. You know, we've learned that we can surge out to different departments. We can house ICU patients in other floors. We can cross-train nurses, ICU nurses, to be surgical nurses, or surgical nurses to be ICU nurses, vice versa. So we've seen a lot of that. We've seen our communities come together. All the hospitals in our community. You know, we consider ourselves somewhat competitive, but during this time we did form a sense of collaboration. So we did come together in that. Even in the outpatient world, we've seen virtual visits now really take a rise. So, you know, I think medicine, and I think, like my colleague said, everything has changed.
And we know that
continue to change.
Yeah, and we know a lot of different things have come down from the CDC, a lot of guidelines. Did you agree with a lot of the guidelines that were set and came down from the CDC?
Well, I think, there was a lot of stuff that came down that contradicted itself. And I think part of the reason is we were still learning about the virus. We still don't know a lot about this virus, and we still continue to learn. So I think there was a lot of confusion. We told people don't wear cloth masks, and we said wear cloth masks. And we said don't double mask. Now we're saying wear double mask. So there's a lot of things going on because this is a dynamic time. And I think it will continue to change. The more we learn about this virus, the more guidelines will come out to keep us safe. And that's what they're doing, is keeping us safe.
So people need to be able to adapt. They need to be able to understand that things are changing, we're still learning, and just be adaptable.
And that's the one thing I think that we've all learned through all of this, is you have to be able to adapt because things are so dynamic.
One thing I did want to include in regards to adolescent mental health, adolescent mental health has always been an issue, and we've never really had the resources in our schools in order to be able to deal with it. I think the pandemic exacerbated the adolescent mental health, but my hope would be that mental health, now that people are talking about it, people actually start doing something about it, and we start to get some resources in our schools to actually deal with it. Because like here in Kern County, adolescent mental health is hard to find, and a lot of times these teenagers end up having to go either into the children's mental health or into adult mental health, which is not adolescent mental health. I mean, their brains are very different. So I would hope that now that people are talking about it, that some real change comes about because of it.
And it continues to become a conversation. Yes, absolutely. Bryn, I want to ask you this question. By the way, congratulations on your new position. Congratulations.
Thank you.
I know I've seen you out at the fairgrounds a lot. I want to ask you, what steps do you think leadership needs to take to get the county back on track to a sense of normalcy? What's next?
So we're already taking those steps. We've seen nothing but great leadership happening in our community. Dr. Cothry mentioned really the hospitals coming together to decide how we can best serve our community as a whole. We've been doing that as a county, leadership coming together. How do we get together and provide vaccination in the most efficient, effective way possible that our community can access in that way? We need to continue those efforts. We have a lot of cleanup to do following the pandemic. That leadership needs to continue on so that we ensure that we get our community back to a healthy place.
Absolutely. Ryan, I want to open up the same question to you. What do you think leadership needs to do to continue? As Bryn said, we're already on that path. What do you think we need to do to continue to get back to that normalcy and get everything back to being reopened?
I think we need to continue to stay agile and be flexible to pivot to the changing needs associated with a pandemic that continually change, as Dr. Cothry pointed out. Been a lot of changes over the last 12 months. We're focused on vaccine capacity right now and maintaining that capacity. We've got the capacity right now to do just under 60,000 doses for residents every single week in this community. We need the supply. It's all about the supply chain, and we're pleased with the progress. Supply seems to be ticking up with each and every week, but we're focused right now on vaccination distribution. And that's where we're going to be until there's a need to pivot again, likely in the near future.
And open to either one of you guys, when do you think we're going to reach a level finally when you say, okay, we've gotten enough people vaccinated in our community, we're starting to get over the hump? When do you think we're going to reach that threshold?
So it's absolutely dependent on the supply that we receive from the state. If our supply levels continue as they are, we're hopeful that by the end of the summer that we'll have enough people vaccinated that we can get back to some sort of normalcy. But again, that's completely dependent on the level of vaccine that we receive.
And speaking of the state, Ryan, I do want to ask you, you've been a huge critic of the state. What are some of the things you think they should have done differently throughout this pandemic?
You know, our criticism came at different times throughout the past 12 months. Granted, this is an unprecedented event, right? There's no playbook on it. And so the governor has done, I think, the best job that he felt he could do in the leadership position that he has for a pretty big state, right? We're a huge state. The consistency, the transparency, the information, right, that was associated with the various directives and guidelines that were handed down at different times, the changes. I think, you know, whether you're a business or you're in education or any other sector of the economy impacted by the directives of the state, there was a lot of frustration in how those were communicated out, how those were decided on. At times we felt like the state didn't work very closely with counties in figuring out how they wanted to proceed.
Do you think that's changed now?
I think that it has changed. There's always room for improvement. I think there's still room for improvement. There's a lot that the state's not telling us still to this day. There's a lag in information that we provide to the state and information that they provide to us, and so there's always room for improvement on every side. But I think our frustration really, and our Board of Supervisors' frustration, has been really on behalf of the people most affected by these shutdown orders over the period of time that they have been in effect. And really it's been about the clarity of the message, the consistency of the message, and really trying to figure out how the decisions were getting made, because at times, again, the state was not working with counties, and some of the people in the business communities felt like they weren't being heard either. So the frustration that I had was a reflection of the frustration of our Board of Supervisors, and I think the frustration of our community.
Do you think we're finally coming full circle though now? Do you think the communication is getting better, or do you still think we have a lot of work to do in order to get that connect back with the state?
I think the communication's better than it has been at any time in the past. Again, there's always room for improvement. This is still a very fluid situation. There's a lot happening. I'm sure the state's going to be making changes going forward. I could surmise that changes will be made within the various tiers that they're shifting counties through. We're getting ready to go into the red tier. Right now, that means a certain thing for certain businesses in terms of opening. That could change. We could see the state making changes within the tier system going forward. So we hope that if that is going to be the case, that there is great thought put in it, that they work closely with the counties, they work with the business community to make sure that we all understand what's happening and we're all on board with those changes.
And Dr. Cothray, I want to ask you, he just mentioned the tier system. We could be moving into the red tier. I know that's something that everyone's talking about. But as we get closer to that, or we get excited for that, what should people keep in mind as we're starting to get over the hump? We are starting to get people vaccinated. From a health perspective, what should people still be doing to protect themselves and their families?
You know, I think we've been talking about this from day one. You know, keep your hands washed, social distance, right? That's been the big one.
So just because you're getting vaccinated, that doesn't mean all the things that we've been taught are going out the window.
Absolutely. You know, and the reason for that, ideally, is because these vaccines are fantastic vaccines that are out right now, but they're not 100%. We also have these variants now that we're dealing with. We don't know what that's going to do, you know, for the people that have been vaccinated. And I think the other big thing is masking. I think, you know, you look around, this is the lowest I've ever seen flu cases. I've been practicing 20 years. I've never seen flu cases this low. Common colds are kind of gone by the wayside. So masking, social distancing, hand washing, these general techniques do help, not only with this virus, but with other viruses, other bacteria as well, other little pathogens.
I think a question that a lot of people have are masks here to stay? Is this going to be a common practice now?
You know what, I think if the mask mandate is lifted, I think you'll see certain industries, including the healthcare system, keep them. You know, it's definitely helping us out. You know, not only are we protecting ourselves from our patients, but we're protecting them from us as well. So I think in certain industries, you'll see them staying forever.
And Jesse, I want to ask you before we wrap up here, what's your hope for your students as we get through the pandemic? What do you hope to see next year, next graduation?
Well, hopefully we get back to in-person instruction in a safe manner, and there's no yo-yo effect. So once we get back into the classroom, we stay in the classroom. And I also like to see some of the technology that we've learned how to utilize over the course of this pandemic continue to be utilized in some way. In-person instruction is by far the best way to teach students, but I do think that the technology that we've learned how to use can be applied as well. And for the most part, I'm hoping that our students kind of what they get out of this is how to work together to meet a goal, because I think that's what this called for. I think regrettably the pandemic became politicized, and the whole notion of even wearing a mask became questionable. And lots of people weren't doing their part. And I think that just made it harder. I think we could have been through this a lot quicker had we all worked together. And the same thing, with going back to in-person instruction. I think, had we all worked together, not just as school districts or as a state, but also as communities, and done the right thing, we could have been through this a lot quicker than we have been. And my hope is that message comes through, that our students stay safe, that their families stay safe, and that we're stronger for it as we move forward.
Absolutely. And last question, main goal of the county, what's next? What are the top things on your list?
For the public health department?
Public health, yeah.
Definitely to start addressing those public health issues that we were trying to address before we even went into the pandemic, and that is hunger within Kern County. We see Bakersfield as one of the hungriest metropolitan areas in the nation, even though we produce the most agriculture in the nation. We have high STD rates, we have high chronic disease rates. So getting back to the programs that were addressing those before we went into the pandemic, and likely that those issues have been even worsened over this time period, are definitely the things that we're going to address as we come out of it.
Perfect, thank you. And Ryan, for the county, what's your goal? What's the end goal here as we're starting to get through the pandemic? What do you hope to see change immediately? What's the immediate goals you're trying to achieve?
I think our economy needs to get back open. I think our schools need to be back, or our kids need to be back in school, in the classroom, across all school districts immediately. And my job as the CAO is to support Ms. Kerrigan and the Public Health Department to make sure that they have everything that they need to be effective, to make sure that we're doing everything we can to support Dr. Cothry and his colleagues in all of our 10 hospitals and the medical system, to make sure that all of that's working correctly, so that we continue to stay concerned and aware of hospital capacity, ICU capacity. That's from day one always been our biggest concern. But at the end of the day, if we can get back to more normal times, I look forward to working with the Board of Supervisors to improve the quality of life for residents who live in this county.
Couldn't agree more. I hope we all get there, and I know we will all get there. Thank you guys so much for your time. We truly appreciate it. And that's going to do it for us. Again, we just want to remind everyone who is watching this, we hear you, we see you. We know we still have a very long way to go, but we are getting there. There is light at the end of this tunnel, and we will come out of the other side better for it. Thank you for watching us. We'll see you right back here at 11. Have a good night.